guys, time for me to finally get around to giving you all a medical update. This one could be a little lengthy, so I'm going to put timestamps down below in the description, and it'll have a little description on what part the timestamp's on, and you can just click on that and it'll skip to in the video where that is if you want to skip around to the parts you're interested in. Where to start? Well, first I'll start with why it's taken me a while to put it out. I promised it a few weeks ago to a few of you, but we got COVID, and I was kind of the hardest hit out of our crew. The kids, I don't even know if they got it or not. They didn't have any symptoms, and they never tested positive. Brett and I both did, and I had a fever for like 5 days. I had a lot of body aches, headaches, stuffy head, stuffy nose, sore throat. And then I was really exhausted for like the week or so after. But doing much better now, feeling basically back to normal. So on to my medical stuff and what's going on with me. I'm also going to do other videos about the kids' medical stuff and updates on that, specifically Elliot's autism diagnosis and where that's all at. But for right now, I'm just going to talk about the medical side of stuff that's going on with me. I'll give a bit of a recap on my health stuff for those of you that don't know. Back in 2010, a couple months before Brett and I got married, I got really, really sick with what we thought was the flu. I was sick for like 2 weeks straight. I didn't stop throwing up, I couldn't sleep. It was just miserable. The doctors were throwing antacids at me. Nothing was working. They did, they thought it was the flu. They tested me for the flu. They gave me a pregnancy test. Nothing came back positive. They finally did an endoscopy, which is the camera down the throat, and they discovered that I had a hiatal hernia, which is where the entrance to your stomach is always open. And it shoves kind of like up into your esophagus. So it normally sits like this and it kind of pushes up in there. And it's always open, and it can cause a lot of nausea and a lot of issues. So they just threw stronger antacids at me and said, okay, you're good, go home. Over the next 6 months, I lost like 40 pounds. At the lowest, before I got pregnant with the twins, I got down to like 118, which was like middle school weight for me. I continued to be very sick, and the doctors just didn't have anything for me. We did a lot of dietary stuff, did a lot of lifestyle changes, different stuff to try to see if it would help me feel better. But things got better, but nothing ever really got solved. So fast forward to my last pregnancy with Xavier. And I had done some research because Brent and Wyatt both had spinal dimples. And I was looking up like what that's related to, and I came across EDS, Ehlers-Danlos syndrome, and realized all of the symptoms really fit what was going on with me. So I asked my doctor to send me to a geneticist, and they sent me to OHSU, and I came away while pregnant with Xavier with an EDS diagnosis. Decided to learn a lot more about that, and then actually had some side effects that were definitely EDS related. At the onset of labor with Xavier, I had a placental abruption, and we planned home birth, ended up in the hospital, and everything turned out okay, but that was kind of scary. And we also realized with finding out about EDS, and we already knew that the 3 older kids were special needs, and now I know Xavier's too. We knew that I had something genetic going on that I was clearly passing on to the kids. So we decided that Xavier would be our last one. Next, I kind of kept trying to find a doctor that would help. Doctors knew I had EDS, but they had no idea in Oregon how to treat it. I finally found a doctor whose kid had connective tissue issues. I guess let me explain a little bit more what EDS is. Ehlers-Danlos, EDS, is a connective tissue disorder. It's where you're hypermobile. As you can see, like my elbows bend extra, and they pop back into place, and I can make my shoulder go in and out on just by myself. and it's a breakdown of the protein in your collagen. Collagen's everywhere in your body. Your brain, your ligaments, your spinal column, your organs, everything has collagen in it. So it can really range the gamut of issues people with EDS can have. Some people have it and they have no issues at all. Other people have a whole mess of issues. So I found a doctor whose kid had a connective tissue disorder, and she had a little bit of an idea, and she put me on a medication called Cymbalta for my headaches, because I had headaches 5 days a week. I was bedridden most of the time, and was very, very sick, and I didn't have a very good quality of life. The Cymbalta helped. It reduced my headaches down to like 2 days a week, made a huge difference. I still dealt with joint pain, dislocations, and all those issues, but it helped a lot. I also ended up getting put on diclofenac sodium, which is the strongest anti-inflammatory that you can take. I take 75 milligrams twice a day. It's commonly given to people with like rheumatoid arthritis and stuff like that, because I have a lot of joint pain and a large amount of inflammation in my body. And that has made a huge difference too. And now my headaches are significantly reduced. I only have a few a month. I still get really bad migraines, but they're only once every couple months. And it's made a big difference. But I still wasn't really getting medical care for the other things that I needed, and we weren't able to get appropriate medical care for the kids in Oregon. So we looked for a couple of years where we could really go to get appropriate medical care. A lot of doctors in a lot of places suggested back east, Boston, places like that, but we had no interest in moving back east. Nor did we want to move to Seattle, and Seattle didn't really have that much option-wise. So we decided on Phoenix, and Phoenix also has a lot of great autism schools, so that was a great piece for our kids since we have 3 diagnosed with autism, and we know the 4th one is. He has his evaluation next month. Fast forward to being here in Phoenix area. There's an amazing neurologist here that EDSers a ton of EDSers recommended. I found him in different support groups and online groups that talked about how great he was. And I self-referred myself to him and filled out a ton of paperwork that he had, a bunch of different questionnaires about symptoms. But it was nice in filling out the symptom questionnaires because I could tell he really knew what he was doing because he asked the right questions for EDS. And he understood a lot of my symptoms. My first appointment was like an hour long of just talking to him about all the different symptoms and all the different issues that I have. And he ordered a ton of tests. And I've been going through all those tests, and I have my follow-up with him here. When is it? It's in March. It was going to be last week, but with COVID, I wasn't able to get all my tests finished, and so we pushed it off till after I complete my tests. The tests that I have done that he ordered an EMG, an electromyogram, which is where they check if your nerves are functioning properly and getting the message to your feet and your hands. They shock you with electricity, and they read how it responds with like electrodes, and then they also stab a needle into your muscles, and use electricity and see if it picks it up. And that came back clear, because I have a lot of issues with peripheral neuropathy, which is where I get tingling, numbness, pain. I'll feel like my leg is wet when it's not, and a lot of different weird symptoms like that. And so he's trying to find specifically what's causing that. Because that test was clear, which he said isn't unusual, but to get insurance to pay for the next test, you have to do that test and show that it didn't come up with anything. So now, next week, I go into his office and I will have what's known as a skin punch biopsy. It'll be on my leg, and they'll take in 3 different locations on my leg. They will, lidocaine me and take a little punch and send it to the lab to look for small fiber neuropathy, which is what he thinks is probably going on for some of my symptoms. The other test that he ordered is a tilt table test. to test for POTS, postural orthostatic tachycardia syndrome. I've definitely got that diagnosis. You have to have, so what they do is they lay you flat, they do a bunch of tests, you're hooked up to an EEG, and then they stand you upright. And most people, when you stand upright, your body naturally adjusts, pumps blood, up to your brain, but it doesn't have to like raise your pulse rate that high to do that. But with postural orthostatic tachycardia syndrome, your body tries to recover and get the blood up there, and it doesn't do it right, so it sends a surge of adrenaline out that makes your pulse increase, and then it can also cause a lot of issues with reduced cortisol, because your body's constantly kicking out cortisol to calm down this adrenaline reaction, and you can end up without sufficient cortisol, which cortisol helps you go to sleep at night, helps you know when you're exhausted, helps you regulate a lot of your body systems. When I went from flat to staying upright, to qualify for the diagnosis, you have to jump 25 beats per minute. I jumped 43, so definitely got that diagnosis. Sorry, I'm saying a lot. But, so that, I already knew I had POTS. I have all the classic symptoms. I've done a supine test where you take your pulse and you stand up. So I was already aware of that, and I've been treating it the natural ways you can treat it. Lots of water intake, extra salt intake, and things to just help you not have swelling. POTS can cause a lot of other random issues with your body. Basically, it's a form of dysautonomia where your body doesn't properly regulate your autonomic system. Your autonomic system is things like breathing, your pulse, your blood pressure, and it can make things very wonky. I also did a swallowing test because I have weird swallowing issues. I guess I'll go back a little. So details on this, I have seen an orthopedist in Oregon who had done x-rays and stuff. And in my cervical and lumbar spine, I have anterolithosis and retrolithosis, which is where your spine hyperflexes too far forward and too far back. And when it does that, the vertebrae displace themselves. And they go out of place basically slightly, and they cross over boundaries where they shouldn't. So back to the swallowing test, everything was happening mechanically correctly in my swallowing test, but the speech pathologist saw in it that I have calcifications on the front of my cervical spine, and my food is getting caught up in the lower part of my throat, below my epiglottis and all that, so I'm not at risk of choking, but food can get caught there and slow down. And then I don't really know what it means that I have that buildup of calcium there. It means I've had damage, but I don't know if there's any form of treatment or what he's going to want to do. I'll find out at my appointment about that. But the speech pathologist recommend that I moisten my food. I always have a water or a drink around when I drink so I can wash the food down well. Moisten, he said, like if I'm eating chicken breast, make sure I have it with like gravy and mashed potatoes, things like that, which are things that I'd already naturally started doing because I was aware of the swallowing issues. Next test, tons of tests. A 72-hour EEG. You'll see that on the thumbnail for this movie. I'll put a picture of me in it. I'd already posted it for this video, not movie. And that's checked for seizures. My mom has epilepsy, and my youngest Xavier has febrile seizures. And we're not sure he only has febrile seizures. He might also have them. He might have epilepsy as well, but we're not sure. We keep an eye on him, and he sees a neurologist regularly. Also have lab tests, blood draw and urine. And he did put me on a new medication while I was there in the office called Cromolyn for MCAS, MCAS, mast cell activation syndrome. We all have mast cells in our body, and they normally help us fight like foreign invaders and different weird, like when you eat food and there's funky stuff in it. But mine basically activate when they shouldn't, and it fights my own body. And it fights my every food I eat can kick it off, and I can end up with headaches and inflammation, nausea, diarrhea, all sorts of unfortunate bowel issues, and just makes things very uncomfortable. He put me on a medication called Cromolyn. I don't think I have it around or I'll show it to you. But they're little tubules. You twist the top off and it's just a clear liquid, and I take it with water 4 times a day. 3 times before I eat and the 4th one before I go to bed at night. And it helps my body not go into that reaction, and I have definitely noticed a difference. I have started to gain weight, which is the first time I've gained weight in the last decade. And I used, I've actually had to slow down on my eating, where before I had to super calorie pack and I still wouldn't gain weight. I'd eat all day long. I'd drink high calorie food drinks, protein shakes, and I would not gain weight. And my body wasn't absorbing the nutrients. And this medication has made it that I've stopped having this allergic reaction, and I'm actually absorbing what I'm eating. So, yay for that. He also has ordered physical therapy with a special EDS therapist that understands my hyperflexibility and not damaging my joints and everything more than they already are. And then he also ordered something called neurofeedback. Can't afford it at this point. It's like $1,000 a month. And we just don't have money like that to help. But it's supposed to be like a machine that I'd bring home, and you hook it up, and it helps your body learn to turn off your brain to turn off pain receptors, basically. And stops you from being in a chronic pain cycle. But we don't have the money for that right now. Maybe in the future. We know that that's an option. And I hear great things about it, but I just can't do it right now. Besides Dr. Saperstein and all of those tests that he did, I've also seen a guy named Dr. Erickson. He's an orthopedic surgeon out of Seattle. He is amazing, very revered in the EDS community. It's really hard with EDS to do surgery. Most surgeons can actually hurt you more than they help you, because they do surgery for like a normal patient, and our joints being hyperflexive, and we have a tendency to have greater scar tissue issues. But this guy, Dr. Erickson, is great, but I need to have, it's not covered by my insurance. The hospital side of the surgery is, but his fees aren't. And I need to have surgery on each of my hands, wrists, and elbows. I have scar tissue built up. I have a lot of pain, a lot of dislocations. I'm not sure if you guys will be able to see it, but when I bend my fingers, your tendons are supposed to stay right here, over the top of it. But this tendon runs over here. And this, pinky tendon runs all the way over here. And all of my tendons basically displace. Instead of staying directly over the knuckle like they're supposed to. And he wants to reattach them and put them back where they go and clean up all the scar tissue that is causing worse dislocations and worse issues, and reattach my thumb as well, because my thumb has the same issue where the tendon slides right over here, and I have a lot of hand pain and issues from that, and actually it causes issues all the way into my shoulders and my neck. But that is $7,500 per side. You do one year and one the next year. And so I'm trying to save money for that, trying to get situated. It's hard with our, 4 special kiddos. Disability is not cheap, and they have a lot of therapies and stuff that they need. Stuff's really been put on hold because of COVID, but we'd really like to get them going with these therapies, and I'll probably prioritize that. But maybe one day we'll have the money we need to get my surgeries. Let's see. I've got a thing over here that I wrote out because I knew I'd forget something and miss it. I think that is everything. That is where I am up to date with my medical stuff. Been doing much better being down here in Phoenix too. It's a lot drier. It's a lot less cold with my pots. One of the things is temperature regulation. That autonomic system, I have a really difficult time with temperature regulation. I get cold fingers and hands. Anytime I get cold, my body has a really hard time warming itself back up. Anytime I get hot, it has a harder time cooling itself back down. But here in Arizona, it's a lot easier to just stay inside with air conditioning than in Oregon it is to heat your whole house. We've just found it a lot easier here for me to handle the heat versus in Oregon handling the cold so much out of the year. And especially where we lived in Oregon up in the mountains, you know, even in the summer at night it was cold. So it's really helped a lot being down here and the weather change, the dry, not having the humidity in the air. My body hasn't had to fight that humidity, and it's made a big difference. And having a doctor down here that understands and all the access to this testing and these options has really made a big difference. Our kids are in an amazing autism charter school that has just been great for them. All 3 of the older kids are in it. The youngest, Xavier, he's 3 now, but he'll go to it in 2 years when he's old enough. Well, I guess a year and a half now almost. Time's flying. But we're connected with places that can diagnose them and follow up and do treatments for them that are way better down here. And it's just been really good for our family. If you guys have any questions, put them in the comments below if it lets you comment. If not, send me a message or put it in the comments on Facebook. And I'd be happy to answer any further questions you guys have and let you know anything you're wondering about. I love you all, and yeah, mwah.